7:36 in Trinidad and Tobago. Let's stay on the sporting theme a bit, but this time from the issue of health, injury, surgery, recovery, because we want to focus on the issue of orthopedic surgery and indeed sports injuries. Let's speak to an expert, shall we? Because joining us via Skype, we have Dr. Daniel Chan, who is an orthopedic surgeon. He's a medical director, and he's at in the Memorial Division of Orthopedic Surgery and Sports Medicine at the Memorial Regional Hospital based in Hollywood, Florida, in the United States. He's originally from Toronto, Canada, so it might be a bit of a switch from Toronto to Florida, but good of you, doctor, to join us this morning via Skype. What do you want to tell us this morning when we talk about injuries, sports-related injuries, and actually the recovering from them? What would you like to tell us this morning?
Well, I think first for all, thanks for having me. I think the important thing is that no matter what your age or activity level, you can always be doing something to get healthier, and that even if you have an injury or a chronic condition, that should not hold you back from maintaining the maximum level of performance that you can achieve. And with the advanced techniques that we're using for sports medicine surgery or joint replacement, people are recovering in very rapid fashion and returning to their previous level of activities without any difficulty.
And when we talk about sports injuries, doctor, we often talk about the elite athletes, whether you're talking about NFL, and I noticed the Miami Dolphins have had a terrible start to the season, so we won't go there as to how things have been difficult for them. But generally, all of these, we tend to think about elite athletes, but what about us ordinary folks outside here who might have the odd twinge and the odd issue and so on? Is it something that we should automatically seek medical attention, or just run through the pain as far as understanding how we deal with these sports-related injuries?
I think that anytime a pain is lingering more than a week or so and isn't getting better with simple things like resting, icing the area of discomfort, or taking over-the-counter anti-inflammatory medications, it certainly warrants evaluation by a medical professional, preferably somebody with sports medicine training or an orthopedic surgeon. You certainly don't want anything that could be treated simply to get worse and then require something more extensive down the line.
And as we talk about different individuals at different levels, what are we talking about as we get older? And I know you have tremendous experience as well in dealing with hip fractures and osteoporosis and all of the issues associated with the aging process. Are we automatically more vulnerable? For example, if someone is a regular jogger, someone who engages in a lot of physical activity throughout his or her life, and as they get older, would they be putting themselves to a greater risk of injury or fractures and greater complications if they were to continue with a healthy physical lifestyle?
I think that's an excellent question. I think the most important thing is that I wouldn't let age deter people from maintaining an active lifestyle. It's true that as we get older, our cartilage wears out, leading to arthritis, which ultimately may lead to joint replacement. It's true that as we get older, our muscles get weaker and our collagen becomes less flexible, so we may be more prone to ligament tears and rotator cuff tears, things like that. But certainly if we go to a sedentary lifestyle, then things like osteoporosis set in much quicker, and we actually are worse off. So there are things we can do to mitigate those injury risk factors, but even as we age, we should always be maintaining an active lifestyle.
And Dr. Chan, if you could tell us a bit as to how much the science has progressed as far as assisting in an athlete's recovery from injuries, because it used to be many years ago when you tore an ACL, well, that was it, you're out for the season and all those sorts of things. How much has the science has facilitated recovery, not just of the elite athlete, but the ordinary individual who might be engaged in sporting activity? How developed is the science right now?
I think that the same techniques that we use for elite athletes we're using for all of our patients. There's no reason that if something is beneficial to one patient, it shouldn't be used for everybody. So I think the advancements are twofold. They're both on the surgical side and on the physical therapy and rehab side. So on the surgery side, if somebody has an injury that requires surgery, we are doing things in much more minimally invasive techniques. For example, in joint replacement, we're doing muscle sparing approaches, minimally invasive approaches. We have much more advanced pain control protocols where people are going home the same day of surgery after a hip or a knee replacement. People who are undergoing shoulder and knee reconstruction surgery for an ACL or rotator cuff, we have much better surgical techniques. We're doing everything arthroscopically. And then on the recovery side, the physical therapists have very advanced protocols in terms of maximizing range of motion and strength much earlier on so that it can return either an elite athlete or a weekend warrior or just somebody who wants to become active, recover much quicker.
And Dr. Chan, what would you describe as your typical sports-related injury or exercise-related injury as far as your own experience over these many years in different areas of your expertise? What comes to mind immediately if I were to ask you the typical sports-related injury?
So it really depends on the age and activity level, but typically as we get into the adult population, we see a lot of knee injuries and shoulder injuries. People who run a lot typically have knee arthritis or meniscus tears. People who play soccer and basketball or other pivoting sports can get ACL injuries. People who do overhead activities such as tennis or baseball or golf typically get shoulder injuries like a labral tear or a rotator cuff tear.
And before we conclude, if you were to just give one bit of advice to someone, an aging person like myself, who might be wondering if should I start jogging around my nearby field once again and I'm feeling a bit of pain in the left knee, should I go ahead and take the risk, or should I have it checked first of all?
I think the most important thing is to maintain a regular exercise routine of low impact activity. So if running is causing a lot of pain, then certainly brisk walking or cycling or swimming, as well as some weight training, will do the most to preserve your bone density, your muscle mass, as well as minimize your risk for subsequent injury.
Dr. Chan, thank you very much for taking the time. I know it's very early in the morning for you as well, but as a medical professional, I'm sure you've been called out at odd hours of the day and night to deal with these different challenges. Thank you very much for taking the time to speak with us.
Thank you for having me.
Indeed. Dr. Daniel Chan, a board-certified, fellowship-trained orthopedic trauma surgeon based at Memorial Regional Hospital in Hollywood, Florida, in the United States. Just giving us a perspective here in relation to sports injuries, whether you're an elite athlete or just a weekend warrior, as you would have described it. 7:44 in Trinidad and Tobago. We'll be back right after this.